So welcome all of you, both old friends and new friends here. I'm Bruce Shapiro. I direct the Dart Center for Journalism and Trauma at Columbia Journalism School, and this is the third in our series of webinars, coffee hours, and brainstorming sessions on reporting amid coronavirus, reporting amid the pandemics, reporting on it, but also doing the work of reporting at this unusual, challenging, and difficult time. Last week, we had two sessions looking at the particular challenges facing local reporters. This week, we're going to focus on learning from coverage of past pandemics. On Thursday, we will have Gina Moore, who did extensive coverage of two different cycles of Ebola. But today, we're lucky enough to be joined by Caleb Hellerman, who is an award-winning documentary producer and filmmaker, has his own company now, but who for many years was the supervising producer for CNN's Dr. Sanjay Gupta. And Caleb is here partly because he's an expert at bridging the science and public understanding gap, the science and journalism gap in general. But he's also here because he has covered pretty much every major pandemic for the last 20 years. He is pandemic guy. He's covered, and he gave me a little list yesterday. Bird flu, H1N1. Well, you'll go through the stars. You can do the whole inventory. But whatever the journalism challenges are of reporting during pandemic, both on the safety side, the science side, and the practical side, Caleb has met them. So I thought it would be useful to have a conversation. We're going to proceed as we have been doing by talking he and I will talk for a few minutes, have a bit of a conversation. But the Zoom chat, which you can access through the chat icon at the bottom of your screen, is also open. And after 20 minutes or so, I'd invite you to chat in questions, and the Dart Center staff will be helping me filter those. We will kind of pass those along to Caleb and see where it goes. This is very much a journalist-to-journalist conversation, trying to do some problem solving around this unprecedented global pandemic, what our job is as journalists, what the techniques, ethics, and strategies are that we can follow to do a good job right now. Caleb, why don't we start out like this? Why don't you sort of orient us, talk a little bit about your first encounter with pandemic professionally, and kind of where that led you and how you've ended up focusing your work so much in that direction.
Sure. Well, I'll try. And first of all, I'll say thanks for everyone for popping on here. And I think we'll try to answer as many questions as we possibly can once we get rolling a little bit. As a journalist, I started covering pandemics. I guess the first one was SARS. Remember that one, SARS-CoV-1. And it was really quite frightening. And I have to say I was covering it from afar at the time. I was working for Good Morning America at the time in New York. So we were watching this unfold in another country, our neighbor to the north. But it was frightening to see how quickly it spread, the kind of reaction it inspired in people. And it sort of quickly became apparent, talking to medical experts, public health people, how quickly this could really get out of hand. And so that sort of caught my attention. I became very interested in this stuff. I was doing some medical reporting at the time. Shortly after that, I did a 4-month fellowship where I got to work side by side with scientists at the CDC. It was this very strange program. I don't know why they agreed to do this, but I got to spend 4 months sort of working alongside epidemiologists down there, and came out of that. Shortly after that was covering the bird flu epidemic in Southeast Asia, doing a documentary for CNN. And I just want to say, fast forwarding through all these things that I've covered along the way, and I think that all medical reporters have had this experience, it's always been the story of the near miss. Like, it didn't really happen. And I think it was easy to get lulled into that sense. And this one here, I mean, it can always get worse, but this is the big one. You know, you talk to the people who have been working on this either as a journalists or as scientists for their whole lives. This is the big one. This is the kind of scenario that people have worried about.
Yeah, and I mean, I will say I remember 10 years ago being part of conversations with folks at government agencies and news outfits about the likelihood of pandemic. This has been on the radar for a long time, but it is the big one. Let me ask you something about that CDC fellowship, because you were working alongside infectious disease experts who now are at the top of the international radar screen. How did that experience, well, two things. First of all, how did the method of those scientists and the methods of the CDC maybe affect your own reporting? And what did you learn about talking to, developing sources among, working with the people who are really in the depths of the infectious disease world?
Sure. I think that's a good question. And I think some of these lessons are not really specific to medical reporting, but it's for any kind of beat reporting. Your best source development is happening when it's not the middle of a crisis. And I think getting to know people in between, when they have a little bit of free time and you learn their methods and you build up some trust before they're getting 60 calls a day is important. Obviously, it's a little late for this one. But more broadly, I guess I learned, one thing I learned is how much work and thought and care goes into making, I would say, predictions, analyses, I mean, especially at a level of the CDC. This is not necessarily true of your local health department, or certainly not true of your neighborhood general practitioner. But there's a lot of work goes into making predictions or the very blunt messages that come out to the public. And I learned to, on one hand, really respect that work. And I think you see in this pandemic, a lot of people there's a lot of armchair epidemiologists. And as we report, it's really worth digging in and asking extra questions, and also just basically looking at what is the background of the person giving this information. Because it does take a certain real expertise to do it well.
Well, and that, I think one of the challenges that a lot of us are facing in reporting now, whether it's at the local level or at the national, international level, is vetting sources and understanding which voices to listen to who are advocating policies, criticizing policies, et cetera, or even giving practical advice about how best to behave in public. How should we think about vetting sources and vetting expert opinion in the middle of a pandemic? It's fine to say we should develop our sources beforehand, but now we're there. We are in the middle of the big one, and the stuff is coming at us. So how do we think about approach, vet, where do we turn, et cetera?
Sure. Well, I think on one hand, I think it's important not to completely be in thrall of experts. We should not jettison our common sense. If something doesn't make sense to you, ask away, dig in. I mean, the CDC guidance on masks is a good example. I mean, for years and years, everyone was told, we think the pros and cons of wearing a mask. You shouldn't do it. It's probably not a good idea. Well, it's come to light that's probably not the case. I think there is some value in wearing masks. So I'm with that disclaimer that experts are not always always correct. Beyond that, I think an easy way is just to look a little bit more on specific credentials. I think there's some element, especially these days, that anyone with an MD or anyone with any medical degree is considered an expert on the spread of an infectious disease, which is clearly not the case. I mean, I think you want to talk, if you're talking about modeling or the spread or how a pandemic might play out, you should talk to modelers, you should talk to epidemiologists, should talk to people with public health degrees, academics or in government. If you want to talk about the clinical details of an infection, whether a treatment is likely to work, you should talk to infectious disease doctors. I mean, this isn't always possible, especially in smaller, in quick beat reporting, but it's important. Not every doctor, a surgeon or a dermatologist is not necessarily an expert on the symptoms of a lung illness.
And even I would say, even on beat reporting and local reporting, it's important to remember that around the world, many communities will have reasonably local access to a university that has a public health department or an infectious disease specialist on its medical faculty or something like that. So there are places to turn. I know one of the questions that reporters are turning to the DART Center for in this, our safety, our own safety wall reporting. And in this particular pandemic, because of the very contagious nature of the virus, the connected ethical question of not wanting to be part of spread. In many, in Ireland and some other countries, journalists are officially declared essential workers. Here in Connecticut, where I am, journalists are essential workers. We're exempt from the general ban on movement. Yet colleagues are still saying, well, we don't want to be moving around more than we should. How do we think about our own safety and community safety and yet reporting effectively?
That's a tough question. And I will say that people are figuring it out on the fly. I'm currently working on a frontline documentary that'll air in a few weeks, another film coming up behind that a few months later, but still supposedly doing filming now. So I'm working on pieces right now, and this is very salient. And I would say it has been a moving target. One best practice, I think, is certainly to have as many facts as we know, as in terms of what is known to be best practices, what are the official recommendations, and not ask our colleagues to do anything that really stretches those bounds. Or if we're potentially stretching those bounds, like you're officially an essential reporter, so you are an essential profession, so you can go out, doesn't mean you always should. But I think it's very important to respect our colleagues' personal limitations and their personal situations. I know the crew I'm working with now is very much in that mind, like people who are single and don't have elderly parents are doing more field work than people who are holding down the ship for 5 people in the household, and they're, if they go in isolation would really cause problems, or they have an elderly parent or something in the home. We need to respect that in terms of our sources. I mean, many people I talk to are very savvy about this, but not everyone necessarily. And I think it's important not to expose the people we talk to risks. We've done things that normally we would never consider, like doing Skype only interviews with people where no one's in the room. As a general rule, I can say we've stripped down our crews. We're doing a lot of things with just one person, a photographer, audio person in the room. Producers are asking questions over the phone. We're not using lavalier mics. We're not touching people. It's TV, so we might have hair and makeup in some cases. Do your own hair and makeup nowadays. So we're setting up boom mics. We're not physically touching people. We're staying 6 feet away. And it's important to keep in mind, 6 feet is not a magic distance. 4 feet is better than 6 feet. 6 feet is worse than 10 feet. Yeah. So, there's a certain level of common sense, but I think it's important to minimize risk. And just like any story, if you were reporting from a war zone, you do the same thing. You would balance the physical risks to yourself and your colleagues versus the value of the material you're going to get.
And I suppose a related way of looking at it is, have I done everything I can to minimize risk?
Yes.
We can't eliminate it, but have we minimized the personal risk to ourselves and our colleagues? Have we minimized the sort of ethical risk involved in spreading the virus? And I think that's an important thing.
And making sure that everyone involved is very aware of what those risks are, so they can make as much of an informed decision as they can. There's unknowns, but make sure everyone has the best information possible. And I think being aware of power differentials, so people are not feeling pressured to go out or do something that they're not comfortable with, I think is sort of worth constantly looking at ourselves and making sure we're following those practices.
One of the things that's happened now is that general assignment journalists and reporters and publications, news sites that aren't science specialists, are being called upon to communicate a lot of critical public health information and to translate science into something that news consumers can use. What have you learned about how to make complicated science real and visible? What works when we're thinking about assigning stories, taking stories, telling stories, sourcing, whatever? What really works in bridging that gap on a crucial health subject?
Well, of course, the first thing is to recognize that it's challenging. This is challenging in the best of times, because science reporting and medical reporting is often very technical. Even as someone who's covered it for 20 years, I'm a complete lay amateur compared to anyone I interview on this topic generally. And so I think it's worth being humble. It's important to be humble. When I talk about armchair epidemiologists, there's a lot of people who read 2 stories in the New York Times and they think, oh, I know this better than the people I'm interviewing, which is not the case. So that's lesson number 1. I guess 2 things to keep in mind are science moves more slowly than a lot of beats. And the kind of things if you are looking out the window and you see a fire truck run into a police car, you know what happened and you can report very definitively on what is in front of your own eyes. That is really not the same with medical reporting. This patient's in the hospital, we gave him chloroquine, he got better. That doesn't mean that chloroquine worked. It's the miracle treatment. And I think that it's important to respect the process of finding answers and getting to definitive information. And part of that, I think, is missing from a lot of the coverage is we need to be better as a profession at communicating uncertainty and odds and how couching information, how we know, and this is not satisfying to a lot of people. And you're going to be pushed by your editors, you're going to be pushed by your audience to tell us something more definitive. And I don't want to weasel on this, but there's a lot unknown. And it's true in this case, and it's frankly true of all medical stories in the early days. There's a lot of things we don't know. And I think it's important to somehow try to communicate that well.
And I'd underscore that our toolkit for reporting usually is based on reporting what we know. We're good at that. We're less good at saying, here's what's not known and how to think about the not knownness of it, especially when that generates fear and maybe opening the doorway for irresponsible speculation. How have you, actually, a related question, in your work, how have you dealt with bad science? Have you confront or anti-scientific assertions? Have you confronted bullshit directly, or have you simply decided to explain what is known?
For the most part, I will say more often than not, we try to ignore it. I think there's a general rule of thumb. We try not to bring up stuff just to knock it down. Partly it's not a good use of our time. Partly it sort of gives undue attention to bad theories. Having said that, you can't completely avoid it. I think you need to take your cues a little bit on the setting, on who the audience is, and what people are paying attention to. And I certainly think fact checks or exploring statements that are true or untrue is important in this kind of pandemic. But again, it's sometimes difficult to say this is flatly untrue. I talk about the chloroquine in that whole episode when President Trump says, here's the miracle cure and all this. It was hard to say that it's not. We are studying it, right? So it's there's a nuance involved. But in general, I have tried to steer clear of just crazy stuff because you could spend all day on it.
There's a related issue, especially during the kind of breaking news phase of a pandemic that we're all experiencing now, which is stress and worry, and both the kind of professional anxiety and personal anxiety. When you were working with CNN and elsewhere, and you would really be in the middle of this, what have you learned about handling stress given all of the unknowns of a fast-moving pandemic?
Well, I think it's like any other stressful story. People who are connected to the DART Center, I think, have given this more thought than maybe some of our other colleagues. Self-care is very important. You do some separation from our work life and our home life. And I have to say, that's one of the things that's really unique about this situation, even in very tough outbreaks like in West Africa covering Ebola. It was in some ways, a frightening time and a frightening place to be in, but there was a cordon sanitaire, there was a border beyond which you could kind of retreat and, somewhat feel safe and catch your breath. And one of the things about this outbreak is it's everywhere, and it's in our homes or in our communities. And so you don't really get that kind of respite, which does make it very challenging. Some of the things that people have talked about a lot, like social distancing is maybe a bad term. We should talk about physical distancing and social connectedness. This kind of Zoom chat is good. To connect with colleagues, to stay in touch with people in some way, to stay in touch with your friends, take time away with your family, do whatever things, as much to the extent you can, exercise, meditate, take some time to yourself is important. But I got to say, it's tough in this particular outbreak, especially if you're in like a studio apartment in New York City.
Yeah. Where are you talking from? You should let people know.
I am in Hudson, Massachusetts.
Yeah.
About 40 minutes west of Boston, and I've had the luxury, frankly, of working largely from home for the last few years. I have offices at WGBH in Boston where I go into normally on a big project, but I do have sort of a work setup at home, and some of this transition was a little more natural for me than I think people have had to completely set up on the fly.
Yeah. Carol Gorga-Williams, colleague and past Start Fellow like yourself, is chatting in that maybe this is too simple, but it comes down in part to relationships with colleagues and former colleagues. The brain drain means a lot of experts in this kind of journalism took buyouts or worse. How have you kind of maintained your relationships with both scientists and specialist journalists in this area to keep your own work strong over time? What sort of strategies have you followed?
Well, I think, I've been a freelancer for the last few years. So I think that comes with the territory with that, where you're hopefully trying to keep up relationships with former colleagues and potential colleagues and maintain a network in a way that's not so easy when you're it's different from when you're in a regular office.
Yeah.
I will say I've found that people there's a certain collegiality. I have gotten calls from bitter rival filmmakers and journalists typically that, we're sharing safety tips. We're sharing guides. How are you working? How are you taking care of yourself? And I try to be as, generous and helpful as I can. And, they have been with me as well. I do think there's a little bit of a spirit of we're all in this together, and a sense of public service that I've found in the people that I've worked with now and in the past.
I have one more thing, and then we'll go to questions from the group. So folks, feel free to chat away. The chat icon, if you're on Zoom, is at the bottom of your screen. If you're watching on Facebook Live, I'm afraid you have to just lurk. Anyway, I've been thinking a lot about the kind of coverage you used to do for CNN when you were producing for Sanjay Gupta, who has been doing such a terrific job in this crisis, as he did when you were working with him. One of the things that strikes me is that you were sort of helped in that sense by having this character front and center, whom viewers can relate to because he's a familiar presence and is a little bit trusted, who then becomes the vehicle through which stories are told, messages are delivered, news is communicated. When you're working now, or as you think about the pandemic now, what kinds of characters should we be looking for as reporters? Not just what kinds of sources, but what kinds of characters do you think will enable readers, viewers, listeners, downloaders to connect and come away with some additional understanding?
Well, it's too easy to say. I think all kinds of characters. I mean, what you said about Sanjay, I think is it's true of generally the art of TV reporting, not to some extent all filmmaking. I mean, it's almost a truism. The on-camera person stands in for the audience. They are the vehicle. They are asking and as a producer, an off-air reporter, you're always thinking about that. What are the person on screen is the stand-in for the things the audience wants to know, that we can convey to the audience. So how do we do that? I think if your format is a little different, whether it's a newspaper story or an online video where you don't have an on-air correspondent, you're still thinking in the same ways of you still are trying to create a connection to the person, your narrative thread, who's going to take you through this. I think this particular outbreak is so, I mean, it's almost everyone in the world, right? It's in however many, well over 100 countries. It will be everywhere. It's in every state. So it's a wealth of opportunity on that level. And I think there's something to the idea of connectedness. We want to know what people who are in the medical profession or in the trucking profession, or this is touching so many, it's touching virtually everyone. And I think it really is an opening for people to share stories of any and all kinds. I mean, because all these stories are relevant to what's going on. I mean, we spent a lot of time talking to, say, in Seattle, delivery people. You know, some of the people who are want us to go on strike for basically hazard pay because it's so dangerous. I mean, these are people who are keeping the economy functioning. I mean, that's interesting. I have 3 kids home from school. What are teachers doing? How are families handling that kind of situation? And obviously medical professionals of all stripes are seeing this in a different light. I mean, their level of exposure is so much greater than the rest of us trying to stay safe at home. So I would say there's a wealth of stories and a real opportunity to try and share them. And one thing I found very interesting, I've seen a lot of sort of crowdsourcing ideas, especially documentary filmmakers are talking about this, trying to sort of get video diary material, remote interviews, creative ways of gathering this material. I think we'll see some pretty great reporting and filmmaking in the months and next couple of years just based on this.
When pandemic is happening, and let me just again say, those of you on Zoom, please chat in questions. You know, one of the things that happens with news reporting a lot is that we gravitate toward the worst things that are happening. And that's natural. As citizens, we want to look at it, and that's also where the news is. But there's also a way in which people turn to, whether it's TV or print or whatever, for stories of positive coping. Where do we look for that evidence in the middle of pandemic? So your films never come out totally bleak, right? Where do you find the engine of some engine of possibility and optimism, even when you're talking about really frightening things?
Sure. Well, as a science and medical journalist, sort of my first stop is for people who are treating patients, who are looking for a cure, who are searching for a vaccine. I mean, there's always, it's easy to take that for granted in a way. I mean, it's amazing. These people are going to work, putting themselves in tremendous risk. It'd be easy to throw up your hands and just go home. So I mean, there's something uplifting and inspiring, and it makes you want to say, man, I can go to work because look what these people are doing. So I think it's always been the case in every pandemic I've covered. People are still going to work. They're doing their jobs, and at least in the medical arena, they're really trying to solve some of these seemingly insurmountable problems. I mean, it's a double-edged sword in a way. All these people making masks or hacking ventilators out of stuff they buy at Home Depot. I mean, it's really a inspiring story, and yet it's not a very happy commentary. I will say it has not really been a big part of my reporting during this epidemic, but I certainly see a lot of community building on the outside, and I've been very interested to see on groups I'm part of, or more or less organized, sort of inventing ways to stay connected and think a little bit more about our social connections. And that's kind of, I think, generally an upbeat story, and it's worth following. I think that this is going to change our society, our world, in lasting ways. I'm not exactly sure how, but I think a lot of these changes are going to stick.
Drudy Shaw in London at the BBC asks an interesting question. She says, how do you make sure you don't get pandemic fatigue? And I'd put that in 2 ways. Maybe as I think back on the past almost big ones, Ebola certainly was a story that went on for a long time in several cycles. How do you, as a reporter, refresh yourself so you don't get pandemic fatigue on a story that's playing out over a long time? And in particular, how do you keep audiences, readers, from pandemic fatigue? How have you thought about that?
Well, the first thing to keep in mind, and I think this has taken a little bit of time, but we're starting to get there, that this is not ending anytime soon. I mean, President Trump may be the last person to realize this, that we're not going to be having our happy ending by Easter.
Yeah.
It is going to go on for a long time, and I guess maybe acceptance is the first step. With that in mind, I can't work 20 hours a day for 6 months straight, or 9 months straight, or 3 months straight. So I think self-care is important. You need to be able to step away, tell people who are pressuring you, say that's not going to happen. We're not going to make that deadline. So far, I've been able to do that. Be realistic about it. So I think taking some time for self-care is important. I think just some regularity in your schedule is something I had to learn as a freelancer in the first place. But when you're not in an office with everyone doing the same thing, it's very important to set some kind of schedule and routine for yourself.
Yeah.
And everyone in America is learning that right now.
Yeah. And what about keeping audience attention over the longer haul? There's a shock level at the beginning. There's a point at which there's empathy, but then there can be a kind of compassion fatigue that may set in. How should we strategize this journalistically?
That's a tough question. Up to now, I think it hasn't. I don't think pandemic fatigue has really been a problem for the audience because it's so urgent. You really don't need to remind people of how present this is. I think there's been other strains, different areas that are more or less affected are seeing it in different ways, and it's important to keep that in mind. Compassion fatigue certainly could happen. I mean, believe me, when they start rationing the respirators, there's going to be some hard feelings, and it's inevitable. That's going to happen. And I think it's worth looking around at the people starting to reach out and make a little bit of connections of people you think are worth talking to about some of the ethical issues. It's worth getting in touch with those people now because they'll be more in the forefront in a few weeks. Yeah.
And that's a whole category, therefore, of sources to be cultivating are people who have special skill in social ethics, medical ethics, but also broader policy ethics. That's actually, I think, a really helpful kind of little bookmark idea to bear in mind while most reporters are still focused on the MDs. Let's also look at the social ethicists. I think that's really important.
Yeah, I was going to say these are not necessarily technical specialists. I mean, religious leaders, how are they thinking about this? So far the only people who've gotten attention are people who are sort of insisting on holding giant church services, but that's that's just a small piece of it. There's religious leaders and just congregants are someone it's worth talking to more.
I think drilling down in faith communities at this particular time would be a really interesting way, particularly here in the U.S., but probably in some other countries too. Vanya from Greece is wondering how we ensure, and in the past when you've worked, how have you ensured the safety of your characters, of your sources, when they're diagnosed positive with illnesses that may bring stigma and fear attached to them?
Well, in the United States, it's sort of an easy answer. I mean, we're always very respectful of people's privacy. You often don't, in most cases, in most stories, you're relying on the medical personnel, frankly, to introduce you to people because you don't know who's sick. That's typically the case. And you agree to a lot of things ahead of time, which I think are right in any way, but it's required or you wouldn't get to talk to these patients. Today it's a little different because you can't sit right outside a line of cars for a drive-up testing clinic. It would be easier to intrude on people's privacy. And I'll just say the short answer is we don't. We're not going to put someone on the air without asking or use their picture or use their name without their permission. I would say it's very important to remember that and try to follow the same practices as best you can if you're working in overseas in a more resource poor environment where there's not the same media infrastructure. I mean, it was certainly true working in Africa, but I think it's true wherever you are. I mean, there's wherever there's a cultural difference, it's worth stepping back a little bit and thinking about what are the ramifications for this person if they are involved in my story. And there's no one size fits all answer. Some people are fine being photographed or filmed or shown, but I think we should be, you need to be very respectful of patients. I mean, they're kind of not there by choice. I think it's more incumbent on you than in some stories.
Carol Gorger-Williams has an interesting question which relates to this in a way. There's not only the question of the privacy of patients, but the question of grief. And when we're dealing with pandemic, we are dealing both with the certainty of large-scale grief, and also to a certain degree with anticipatory grief. We're all a little looking around wondering who's going to be around in a month, which is a very strange way to live life. From a sort of reporting point of view, in the past, when you were doing your pandemics work, did you choose to depict the grief side of loss of this? And if so, how? B, what are your ideas on how we might cover grief in an era of social distancing when there are not going to be funerals, when, local newsrooms are all going under anyway? Talk about grief as a part of the public health story here.
Heavy topic. I mean, first, we're not very good in general, even outside of pandemic, with reporting on grief or talking about grief. This is not there's a country that's sort of, not the first person to say it, is allergic to the concept of death. We're supposed to be so optimistic. We don't have a lot of mutually accepted rituals for handling grief or death, end of life. These are all tough issues, and now it's sort of being pushed. Some of those buttons are being pushed. I mean, I've seen some wonderful print reporting, just looking at individual stories and what it's like to say goodbye to someone when you can't physically be there to hold their hand, or where there isn't a ceremony. I think one thing I've learned, and I'm not quite sure how to handle this. This is true during the bird flu epidemic at the time we were in Thailand, and certainly in West Africa. You find that some of the things you might do for your personal safety, you can't do. You can't walk up to a family who's mourning someone and come up with a hazmat suit and talk to them. You can't do that. So I think with some thought, we perhaps overstep the bounds of total personal safety to try to cover those stories. And I don't think it was anything particularly reckless, but I think it's important to understand the limits of what we can do, both to protect ourselves and what our role might be. I mean, there's certain gatherings and certain rituals that frankly we're not part of, and we shouldn't interject ourselves. I mean, there's sort of a level of respect that just because this is not true of just a pandemic, but just because it's a news story, I think you need to be respectful of the people involved. You're not just going to run in there with a camera and say, "Hey, get out of the way. I need a shot of the coffin."
Yeah, I suppose I would add Carol to your question. This is a moment when a lot of local news sites and publications and platforms might remember the approach taken first by the Daily Oklahoman after the Oklahoma City bombing, and remember the New York Times approach after 9/11, the portraits of grief approach, which was to decide that an event was of such singular importance that every life lost should be chronicled in a journalistic way. Tell the stories of people in a particular community. That will take resources. It's really important. And that in turn also leads me to a comment from Angelina Fusco in Belfast, who is reminding me that another time this was done in a quite interesting way was in Northern Ireland, where a group of journalists led by Seamus Kelter's Dart Center Ockberg Fellow and David McKittrick, created a book called Lost Lives that tells the story of every single one of the 3,700 plus people on all sides who died over the course of the civil conflict there. You could imagine, and Angelina, I'm just going to read this, perhaps by media organizations collaborating to tell the life stories of those who died, maybe one global website and in a global website version of Lost Lives. You certainly could do regional, local, state, or national versions of that. And I think Lost Lives you can get a feel for it online. Angelina, maybe you can share a URL. But there are going to be ways we're going to have to innovate obituaries and innovate reporting. In Italy, they're already doing it. This came up on this conversation last week. In Italy, newspapers are filled with the notices of all sorts of folks who died. I'm going to ask one more round of questions to you, Caleb, one more sort of general question, and then we'll call it a day. Thinking back over all of these different pandemics that you have covered, from now and Ebola all the way back to the bird flu and SARS, what would you say are the top 2 or 3 journalistic lessons you've taken away? What are the things, if you were telling a room full of reporters, here are the 3 things you really need to emphasize and remember, what would they be?
Well, I guess the first things would be very much in line with what I talked about earlier, with the challenges, perhaps the unique challenges of science and medical reporting, that things happen slower than in a lot of normal news, or at least conclusions are drawn more slowly, and it really does take time to get a clear picture of things. You're seeing a little bit of that now, and with some of the arguing over what does the modeling show, what does it reflect, what is the proper advice to protect ourselves, and it's going to change over time. And I think especially in the early stages of a pandemic, which we unfortunately probably still are in, things are going to change over time, and we should be humble in our conclusions. Along that way, I would say it's very important to communicate the uncertainty. I think I really can't say this enough. I mean, our reporting needs to communicate what we don't know, and a range of possibilities, and perhaps how our actions will impact those possibilities. And a third thing is of course, I'm stating the obvious, but in this, when we're afraid, when we're busy, it's easy to lose sight of our collective humanity. I think it's something that's for our reporting and for ourselves. All of these stories, our reporting will be better if we remember that these are human beings with their own rich lives and their own memories and their own experience that they bring to this point that we're interviewing them, whether they're a healthcare provider who's suddenly sick, or someone who is being told to shelter in place and they don't have a home. There's always, people are going to experience this particular story, this experience in very, very intense personal ways. And I think it's important, that's almost a starting point for our reporting. Before we jump in with a lot of nosy questions, it's like, how are you doing? And I think it's grounding to ourselves. We talk about avoiding pandemic fatigue. It's a way of reminding yourself that you have your own concerns along these lines. You're thinking of your own family when you're out reporting. And also, I mean, how is anyone going to trust you unless you care about them a little bit? So, I mean, there's a little bit of relationship building, and it's just, I think, a good habit to get into.
Well, I think that is as good a place as any to wind up. I want to thank you, Caleb. Thank everyone here for being part of the conversation and for the questions. I want to thank the Dart Centers, Kate Black and Ariel Richin, who have been driving the car, and Susan Kaplan, who has been lurking on the line from Western Massachusetts, where she is preparing tip sheets based on this and other Dart Center programs over the course of this crisis. We will be back on Thursday with Gina Moore, who will be talking about her experience covering Ebola, and in particular, how you keep the focus on the human story over a period of time and what pandemic affected communities themselves most need. That will be at 11 a.m. Eastern time. These seminars are a little bit of a traveling medicine show, and you can register for the Zoom part on Eventbrite or through the Dart Center website. This time we were not, it turns out, on Facebook Live. There was a technical glitch, but this video will be posted on the Dart Center website after we clean it up just a little bit. So thank you, Caleb. Thank you all, and see you on Thursday, and bring your friends.
Yep. Thanks for organizing, and I'll just say I'm happy if you want to share. I'm happy to answer questions offline, or if people think of things later, just feel free to share my contact information.
Can we share contact with everybody who was on this seminar?
Yes, that's fine.
Okay, you may live to regret it, but we'll do it. Take you at your word. All right. Thank you all.